Police officers are human. They don't simply forget the cases they investigate. In fact, in 2018 alone, 122 Boston police officers encountered a traumatic event on the job. Newly appointed Commissioner William Gross is committed to face this problem head-on. As Police Commissioner of Boston, why has officer wellness become such a priority for you? It clearly is.
The leading cause of police officers dying in the United States is by their own hands. That's suicide. And I'm going to tell you personally, in my career, which is going on its 36th year, there's just been several tragedies. And there's always these questions like, what could we have done? There's no sign sometimes. What can we do? What can we do to help prevent suicide in law enforcement? And I just think it's time to talk about this openly, that police officers are not robotic. We have feelings, we have empathy, we have sympathy, we have issues that need to be addressed, a lot of them by seeking counseling.
Officer wellness covers a wide range of topics.
Yes,
what are some of the issues and some of the stresses that police officers face?
Well, quite frankly, the job itself, you can see the joys of life, but often you see the tragedies as well. So we see homicides, we see people injured, shootings, stabbings, or just some hardships. What about crimes against children and the elderly? All that contributes to the stress that we have on this job. It definitely affects us mentally, or you wouldn't be human.
The Boston Police Foundation funds the Boston Police Peer Support Unit, which does amazing work with your officers. Talk about the importance of that work.
In these modern times, we often hear about counseling, trauma counselors. We should have the same thing for our police officers. If you're to the point where you're trying to internalize everything, and you're to the point where that's affecting your behavior at home and on the job, there is the peer support that can help you address those problems and issues that you face. And it's professional. Your name's not given out. They're not a reporting mechanism to the command staff and upper management. We're here to actually help the officers, and guess what? The families too. We're nothing without our families. And trust me, this job can be devastating to families. So if we're gonna heal officers, we need to heal the families, the children, and all of our loved ones that are going through it with us.
Since 1993, the Boston Police Foundation has made it its mission to prioritize officer health and wellness. In 2018, they funded 830 hours of clinical support. In addition, they provided $325,000 of gym equipment to promote physical wellness. Carl Jenkins, chairman of the Boston Police Foundation, leads the organization's efforts. Why is officer health and wellness so important to the Boston Police Foundation?
These officers get up in the morning and they don't know what their day is like. The rest of us, we get up, we get a general idea what our day is going to be like. Think about getting up in the morning, getting dressed, and not having a clue what your day is going to be like. And it could be absolutely boring, or it could be absolutely horrific. And then you come home to your spouse and your family who don't necessarily have the tools to deal with the trauma that an officer has gone through. So the city can't always afford it. They do some, but it needs to be more.
We were together back in September for Suicide Awareness Month on City Hall Plaza with our organization, AFSP, along with the Foundation and the Boston Police Department. If you could talk a little bit more about that partnership and why you feel it's so important.
First of all, it's incredibly valuable, and it's one of the reasons is because you don't have to go back too many years to realize how little suicide was discussed, and certainly in the Boston Police Department. And it's amazing to realize that the risk of dying by suicide is significantly higher than it is by dying in the line of duty as a cop. So I think it demands more attention, and it requires support from organizations like the Boston Police Foundation to be able to help provide that, and your foundation to bring it into the public discourse, public conversation.
In September, we brought awareness to everyone. As we stood there together in solidarity and talked about September being Suicide Prevention and Suicide Awareness Month, and that police officers are human, and it's okay to say you need help, and the Boston Police Foundation led the way. So it showed that, listen, we're here for you. There's people that actually care about you. We're putting our money where our mouth is and funding support for you for officer wellness. It's welcomed, and we really appreciate it.
The Boston Police Foundation needs your support to continue funding officer health and wellness programs. Help back up Boston's finest. Donate tonight.